Hi, my name is Kara Lorenz, and the purpose of this video is to introduce a client, provide psychoeducation about arthritis and alcohol dependency, and to explain how arthritis can affect physical and psychosocial functioning, as well as interactions between common medications to treat arthritis and alcohol. So psychoeducation provides clients with information to help them learn more and understand more about a diagnosis or an illness that they may have. And it also explains ways to cope with those diagnoses or illnesses safely and effectively. So in this case, the diagnosis is going to be arthritis and alcohol dependency. And the client we're going to be talking about is Susan, who is a 76-year-old Caucasian woman who has been experiencing arthritis in her knees and hands, as well as pain in her spine, which makes getting out of bed really difficult for her. Susan stated that the medication prescribed for her arthritis isn't helping, and the only thing that really does bring her relief from the pain is taking shots of tequila. She also believes that the best thing for her is to stay indoors and to stay in bed, because the less wear and tear on her joints, the better. Arthritis is inflammation or swelling in the joints that can cause stiffness, decreased range of motion, and pain. And it's more common in older adults, and it usually gets worse with age. So although there's no cure, treatment can reduce the pain, and it can make it not get any worse than it already is. The two most common types of arthritis are osteoarthritis and rheumatoid arthritis. And osteoarthritis is the most common form, which involves wear and tear on joints. And then the cartilage, which is the coating on the ends of your bones, wears down, and it causes your bones to grind on each other, which can be really painful. And although it's usually caused by wear and tear over the years, it could also be caused by an injury or an infection in the joints. Arthritis affects physical functioning by limiting the range of motion, causing pain, and causing stiffness. And it can make completing even the most basic daily tasks really challenging and painful. Arthritis can affect psychosocial functioning by basically because if you can't do the things that you've always been able to do, it can lower your self-esteem. It can make you not want to do those things and cause depressive symptoms such as isolation, not wanting to see family and friends, not wanting to leave the house. And it can even cause feelings of helplessness or hopelessness. Arthritis and medications are usually acetaminophen for mild to moderate pain, non-steroidal anti-inflammatory drugs such as ibuprofen and Aleve to reduce inflammation in joints, and duloxetine, which is a pain reliever for chronic pain. And when that is combined with alcohol, there could be really dangerous side effects to that. So that may be liver damage, gastrointestinal bleeding, kidney damage, decreased alertness, and when those effects are over a longer period of time or combined with really heavy drinking, they're going to be more severe, and it could even lead to death. Alcohol affects many parts of our bodies, but one in particular is our cognitive functioning. Depending on the amount of alcohol consumed and how often it's consumed, whether it's mild to moderate, alcohol can cause memory impairment, blacking out, impaired decision making, recklessness, even dizziness or falling. And then if it's more severe and frequent, then it's going to have more severe effects on your cognitive functioning, such as decreased gray matter in your brain, inability to learn new things, permanent memory loss, vision changes, loss of attention span, and Wernicke and Korsakoff syndromes. The signs of alcohol dependency are consuming alcohol in larger amounts over a longer period than was intended, a persistent desire or unsuccessful efforts to reduce alcohol consumption, spending a great deal of time trying to obtain alcohol or recover from its effects, cravings or strong urges to use alcohol, recurrent alcohol use resulting in failure to fulfill major obligations, continued alcohol use despite the persistent or recurrent problems that it causes, important activities that are given up or reduced because of alcohol use, increased tolerance, and withdrawal symptoms. So a social worker could be a resource to this client by providing psychoeducation about arthritis, the dangers of combining alcohol with arthritis medications, and then healthy and effective ways to cope with arthritis, as well as validation that arthritis is really painful and can prevent you from doing things that you've always been able to do before. And then they could also teach coping skills, help motivate her to follow through with implementing those coping skills, and then provide resources in the community that could be helpful. Resources that could be useful to this client specifically is pamphlets that could be provided by a medical professional that may help explain things more efficiently and effectively than a social worker could, as well as teaching her how to manage her pain without the use of drugs or alcohol. So that could be through stretching, heat packs, cold packs, yoga, even making a schedule of how much time she should spend outside compared to inside, or acupuncture. And then also providing information that staying in bed and staying inside may make you think that you're reducing the pain, but it's actually going to make things worse. And community resources that could be provided to her could be Alliance on Aging for peer support and counseling, because it may be helpful for her to have somebody really similar in age with her come to her house and help her get out, motivate her to take walks with them. They could even do chair yoga together at In Shape, which is yoga but in a chair for people who have less mobility, so she can still stretch and get out of the house and meet new people. And then maybe that person, the mentor, also has arthritis and they can share what worked for them. In closing, what I've learned this semester about older adults and gerontology as a social work specialty is more than I ever thought that I could. I learned about engagement and assessment with different ages of older adults, ageism, empowering and embracing autonomy, providing resources, building rapport, identifying cultural norms and differences. So that could be even growing up in different times, either without the use of technology, with the use of technology. Maybe they grew up during a war, depression, anything like that. And I learned how important it is to advocate for older adults, because a lot of people don't, and they're often a group of people that are overlooked. And if we're lucky, someday we'll all be older adults and we'll need somebody to advocate for us.